Today, Zimbabwe joins the rest of the world in commemorating World Cancer Day. This is a day set aside to increase awareness of the scourge of cancer globally and here in Zimbabwe, so that we renew all our commitments towards prevention, early detection, treatment and care for all forms of cancer. This year's theme, I am and I will, is very timely for us as a nation. It is a call for commitment at a personal level to live a healthy lifestyle and to educate oneself and others about cancer, and also to know what to do in the event of a diagnosis of cancer. All of us here should feel motivated to take action against all forms of cancer individually and collectively. The theme runs for 3 years and is in its second year now, and as a country we commit to commemorate this day annually to reduce the illnesses and deaths from cancer and keep cancer prevention and control high on the national agenda. Global cancer burden. According to the World Health Organization, WHO, cancer is the second leading cause of death globally and was responsible for an estimated 9.6 million deaths in 2018. Globally, about 1 in 6 deaths is due to cancer. It is sad to note that approximately 70% of deaths from cancer occur in low and medium income countries, and as a country we are not spared. According to the Zimbabwean National Cancer Registry annual report for the year 2016, the total number of new cancer cases were 7,265, comprising 3,123 males and 4,142 females. Vasikana, ungati isusu we are most hard hit. Experience has taught us that while these statistics are high, they are just a tip of the iceberg, as some cancers are not captured in our routine health information systems. This is partly because some patients seek alternative treatments and do not present at formal health facilities. Some die before final diagnosis, while some deaths are not formally registered. The leading cancers in Zimbabwe, according to the registry, are cervical cancer in women, breast cancer, Kaposi sarcoma, prostate cancer in men, non-Hodgkin lymphoma, and non-melanoma, eye cancer, esophageal cancer, and cancer of the liver. Cancer can start in almost any organ or tissue of the body and is characterized by abnormal cell growth. The cells grow uncontrollably, go beyond their usual boundaries to invade adjoining parts of the body and or spread to other organs. Cancer affects everyone everywhere, the young and old, the rich and poor, men, women, and children. Then represents a tremendous burden on patients, families, and societies, and the healthy delivery system. It is a serious and growing public health challenge in the world and is a major non-communicable disease together with hypertension and diabetes, among others. Today, we are gathered here to empower the nation and the rest of the world to take action against cancer. Most risk factors for cancer are lifestyle related. Choices and behaviors that we make daily, such as consuming unhealthy foods. Patanzi zvinotapirisa, zvine mafuta akawanda, zvakakuyiwa maningi, zvakatsetseswa, ndo zvimwe zvezvimwe zviri kuti wedzera iste tisingazivi. Most risk factors for cancer are lifestyle related. Choices and behaviors that we make daily, such as consuming unhealthy foods, lack of exercise, tobacco use, and excessive alcohol consumption expose us to cancer. In addition, exposure to some chemicals or carcinogens such as asbestos, organic solvents, some pesticides, physical carcinogens such as ultraviolet and ionizing radiation, and biological carcinogens such as infections from certain viruses, bacteria and parasites also expose us to the risk of getting cancer. Aging is also another fundamental factor for the development of cancer. Kukura chaiko, mazera atatu vaiwana, takatarisana mafesi edu vatangozivana kuti age inenge iripo ipapo, asi zvanzi imwe factor futi inoita kuti development of cancer ivepo. We therefore have an important task as a nation in the fight against cancer, given this wide range of predisposing factors. The World Health Organization informs us that between 30% to 50% of cancers can be prevented by avoiding these risk factors. This means modifying or avoiding key risk factors and behaviors can significantly reduce the burden of cancer in Zimbabwe. The National Cancer Prevention and Control Strategy highlights the 5 pillars of controlling cancer in Zimbabwe, which we collectively need to strengthen if we are to win the war. And these are cancer prevention, early detection, diagnosis and treatment, palliative care and rehabilitation, cancer surveillance and research. Ladies and gentlemen, the health of all citizens remains high on the agenda of the government of Zimbabwe. In line with the Sustainable Development Goals agenda and indeed our own universal health coverage drive, we endeavor to promote the healthy and well-being of all people in Zimbabwe. In the spirit of leaving no one behind, the government, through Ministry of Health and Child Care, has institutionalized several policy measures and interventions for the prevention and control of cancer. I stand before you here as the health ambassador. At this juncture, allow me to inform you that I will continue to advocate for early cervical cancer screening and treatment to women in all parts of Zimbabwe through the ministry's VIAC program. I will also continue to fight for children, the elderly and the poor against cancer for early detection, effective and comprehensive treatment in the nation. We call upon all our women and all citizens to seek and utilize these services for effective cancer control in the country. The other key interventions expected to drive our cancer control programming include cancer awareness campaigns by our healthcare workers, civic organizations, partners in health and the media in line with the National Cancer Strategy. Coordination platforms such as the Multi-Sectoral Social Determinants on Health Working Group, which includes cancer prevention and awareness in its mandate. School health program and workplace-based wellness programming, which promotes health lifestyles and minimize exposure to carcinogens. Enforcement of tobacco control regulations, provision of immunization services for cancers of the liver and of cervix through high coverage of pentavalent and human papillomavirus vaccination in children. The human papillomavirus, we had it in Manicaland last year, beginning of last year, May 2018, with Dr. Mnangagwa. Tichitanga nevana between 10 to 14. As we managed, takazotenda kune imwe conference is First Ladies of Africa. Unovunzwa kuti munyika mako uri kuitei nenyaya dzehealth. But because nandine madoctors vanenge vachindiudza ndichidzidza ipapa nokuzvidawo semunhu akabhinga achidawo kuita doctor, ndobva ndakurumidza kubva ndazvibata. Unosumuka uchitaura wakachangamuka ka pane mamwe ma-first ladies tikazovaccinata neinonzi tichidzivira inonzi HPV. Unenge wakutaura uchidimudzira kuti vaone kuti uri mazviri. But you know what came out of that? Vakazobvunza kuti, but how did you manage to do this more than 800,000 vana vechikoro? Nokuti kune dzimwe nyika azvisati zvasvika sematauriro avaita Dr. Mnangagwa. Maresults ari kushowa kuti Zimbabwe we are number 2 sezvataurwa kuti tiri pamberi, ende tinongoda kuti tirambe takadaro tichishingaira pese patiri tichitaura nyaya dzecancer dzedu. Treatment of parasitic diseases including bilharzia, which causes bladder and urinary tract cancers. Promotion of safer sex practices. This particularly applies to the prevention of cervical cancer, liver cancer due to the human papillomavirus, hepatitis B virus, and HIV, which are risk factors for the cancers. Monitoring and controlling environmental factors that predispose individuals to cancer, integration of palliative care in the health delivery system. Allow me at this point in time to thank partners of the ministry and private organizations that have supported and assisted in providing services for prevention, detection, treatment and care for cancer in the country. May you continue with the good work in improving the quality of life for Zimbabweans until we realize the vision of elimination of cancer as a public health problem. Remember, prevention is better than cure. May I end by saying, early detection of cancer saves lives. Let us come together as a family, community, nation, and as the world and scale up early detection, as some cancers can be treated if detected early. It is your role to report early to the nearest health center. Indeed, I can and I will is a befitting theme, for we all have a role to play in alleviating the burden of cancer on our society. This is the time to take action to protect ourselves, starting by you as an individual, starting by us as a nation. As for me, I will remain your advocate for cancer elimination, for I can and I will continue to call for improved cancer care. I thank you.